Welcome to the European Parliamentary Research Service podcast on a joint European approach to vaccination.
As COVID-19 has proved once again, diseases do not recognise borders.
So with labs around the world in the race to find a vaccine, it is time to ask ourselves the question, what can the EU do to help? Is there European added value concerning vaccination? Stay with us.
Despite growing resistance to them, vaccines have revolutionised modern medicine and greatly reduced the spread of some deadly diseases such as measles or polio.
Vaccination programs have also led to the complete eradication of smallpox, which is estimated to have killed up to 300 million people in the 20th century.
And let's not forget that each year, seasonal flu vaccination prevents around 2 million people in Europe from contracting the flu. But despite all these successes, the European Parliament, the Commission and other experts have highlighted a decline in public confidence in vaccination and insufficient vaccination coverage rates in some parts of the EU.
So what can the EU do about this?
Well, although public health, and thereby vaccination, is the responsibility of member states, the cross-border threats posed by low vaccination levels, coupled with the recent outbreaks of vaccine-preventable diseases and now the spread of COVID-19, have brought this issue to the forefront of the EU health policy agenda.
Surveillance, coordination, networking, joint procurement and funding have already helped create economies of scale, unlock the potential for innovation and address cross-border health threats. But there's much more we can do together. Stay with us.
Most EU countries already have effective immunisation programmes in place. Nevertheless, immunisation levels have recently begun to decline, mainly due to vaccine hesitancy, but also as a result of insufficient funding.
Another challenge is the existence of known pathogens that cause diseases for which no vaccine yet exists, such as HIV, Zika, and the coronaviruses causing SARS and MERS.
After the outbreak of SARS in 2003, researchers were close to finding a vaccine. But as the situation improved, the search for a vaccine lost momentum. That's probably one reason why we still don't have a coronavirus vaccine.
So here are some things that the EU could certainly do to address current gaps and barriers. First, invest in research and infrastructure to be better prepared for pandemics. This means, for example, developing vaccines against diseases with pandemic potential before they become one, or improving training for health workers so they know how to act in a coordinated manner when a pandemic strikes.
And because reliable information and transparent communication are of the essence in such situations, the EU can also play a key role in improving information about vaccines and dissipating fears.
Beyond the obvious health risks, the EU could also help to increase understanding of the economic impact of not vaccinating and help address inequalities.
No one knows for certain what the health, social and economic impact of COVID-19 will be for Europe and for the world, but it will be big. So let's seize this opportunity to draw some important lessons and be better prepared next time a pandemic strikes.
You're listening to the European Parliamentary Research Service podcasts.